A patient walks into a dental office with some inflammation around their front tooth implant. The periodontist takes one look, runs some tests, and recommends opening up the gums, bone grafting, placing membranes, and using some PRP therapy. Total cost $3,000. The kicker, they tell her that bone loss is inevitable, and if she doesn't do the surgery, she'll lose her implant. But here's what they didn't tell her, and it's exactly why you need to watch this entire video. When I looked at her 3D scans, I found something completely different, something that would save her thousands of dollars in unnecessary surgery. Stay till the end of this video because I'm going to show you exactly what I found on that scan and teach you the red flags to watch out for so that this doesn't happen to you. Hey everyone, Dr. Choi, board certified periodontist here. Today I want to share a real case that perfectly illustrates a major problem in dentistry, overtreatment. And I'm going to walk you through exactly how to spot it. So let me give you a little background on this case. This patient came to see me after a pretty anxiety-inducing experience. She's in her early 30s, and she was born without one of her adult front teeth. This happens to about 2% of the population. It's called congenitally missing teeth. When she was younger, she wore what's called a Maryland bridge, basically a fake tooth glued to the back of her adjacent teeth. Then in college, she had a dental implant placed by an oral surgeon. This was about 10 years ago, and honestly, it had been doing great all this time. But recently, she noticed some inflammation around the implant. She went to an emergency dentist who saw some bleeding and pus and prescribed an antibiotic and referred her to a periodontist who's a gum specialist. Now here's where things get interesting. The periodontist takes measurements and tells her that she has bone loss on the front side of her implant. They present her with a treatment plan that includes what we call open flap surgery, which means cutting open the gum, bone grafting, adding some bone material, membrane placement, PRP therapy using her own blood platelets, which the cost of all this was about $3,000 to $6,000. And here's the scary part. They tell her bone loss is inevitable and that without this surgery, she'll eventually lose her implant. They also wanted to do some gum grafting on several other teeth, but we'll get to that in a minute. Now, I want you to put yourself in her shoes. You're hearing medical jargon, you're being told that you have bone loss, you're being told that your implant is at risk. It's overwhelming, right? And that's exactly how she felt. So she did what any smart patient should do. She got a second opinion. And that's when she found my YouTube channel and booked an appointment. So when she came in, I did a thorough examination. First, I checked her gum pockets around the implant with a periodontal probe. I'm measuring the depth between the gum and the implant. Her measurements were 3 to 4 millimeters with some mild bleeding. Now that's not perfect, but it's also not terrible. I've seen way worse. What she has is called perimucositis. That means inflammation of the gum tissue around an implant, but without bone loss. Now this is really different from periimplantitis, which is when you actually have bone loss around the implant. That's a more serious condition that's harder to treat. So already I'm thinking, okay, we got some gum inflammation, but is there really bone loss like the other periodontist said? So I pulled up her CBCT scan. That's a 3D x-ray that's used to see the bone in 3 dimensions. And this is where everything changed. I looked at the front surface of her implant, the area that they said had no bone, and guess what I found? She had bone. Not just a little bit, she had 1.6 millimeters of cortical bone on the facial aspect of that implant. Now let me explain why this is such a big deal. When we place implants in the front of the mouth, especially in patients who are congenitally missing teeth, one of our biggest concerns is not having enough bone on the outside, the facial or buccal surface. That's because the bone there tends to be thinner. And if you don't have it, you can get aesthetic problems, recession, and yes, maybe eventually implant failure. But this patient, she actually had good bone coverage. She's one of the few lucky ones. Not everyone who's born without a tooth has as much bone when we place implants. So the periodontist who told her she didn't have enough bone on the front and needed more bone grafting, they were wrong. And not just a little wrong, they were recommending a $3,000 to $6,000 surgery that she absolutely did not need. I told her straight up, if this was my mouth, I would not do this surgery. And here's why. Here's something that most people don't realize. Sometimes doing surgery actually makes things worse, especially with front teeth implants. When you open up the gum tissue around a front tooth implant, you risk several things. Number 1, losing the papilla. That's a little triangle of gum between your teeth. Once it's gone, you get black triangles that are really hard to fix. Number 2, gum recession. The gum tissue can shrink back after surgery, especially if you already have thin gums like this patient did. Number 3, creating problems where there weren't really any in the first place. Sometimes the act of surgery itself causes inflammations and complications. Number 4, wasting money. Obviously spending thousands of dollars on something you don't need. This is the front tooth, people. It's the first thing you see when people smile. You want to be extremely conservative and careful before you start cutting and grafting. The principle here is this: if it's not broken, don't fix it. Her implant had been stable for 10 years. The bone was good. We had a simple inflammation problem, not a bone loss problem. So you may ask, what did I recommend instead? Something way simpler and way cheaper. First, better antibiotics. She had been prescribed clindamycin by the emergency dentist because she is penicillin allergic. But here's the thing: there's so much antibiotic resistance to clindamycin now that we barely use it anymore. I switched her to doxycycline and flagyl, which are much more effective for dental infections. No alcohol while on flagyl though, that's important. And I know there are some dentists out there watching who would prescribe something different. I get it. This is all subjective. Second, I recommended a gingival stimulator. This is basically a little rubber tip tool you can buy on Amazon or at CVS for like $5. You dip it in hydrogen peroxide and gently massage it along the gum line around the implant, maybe like 3 times a day. I know it sounds too simple to work, but I learned this trick in residency, and I've seen it work time and time again. What you're doing is mechanically removing bacteria from around that sulcus, the little space between the gum and the crown. Bacteria is what causes the inflammation, so if you remove it consistently, the inflammation goes away. Third, I temporarily recommended hydrogen peroxide. Regular 3% peroxide from the drugstore. Rinse for 20 seconds once or twice a day. It's antimicrobial and helps reduce inflammation, and then you can discontinue after the inflammation is gone. That's it. That's the treatment. Total cost, maybe $20 for the stimulator, peroxide, and the antibiotics. I told her to do this for a week and come back for a follow-up in a month. I'm confident this is going to resolve completely. Now, I don't want you to think the other periodontist was completely wrong about everything. There was something that needed attention, just not the implant. This patient has what we call a thin tissue biotype. Basically, her gums are naturally very thin on certain teeth, specifically teeth numbers 5, 11, and 12. When you have thin gums, they're more prone to recession as you age. She's 30 now, but by the time she's 40 or 50, these areas could have significant gum recession if we don't address it. So did I recommend connective tissue grafting for those areas? Yes, but not right now while we're dealing with this implant inflammation, and not the way that they suggested. The other office wanted to use something called alloderm. That's cadaver tissue, human donor tissue. It's used in burn victims and is popular in dentistry, but here's a problem. For patients with very thin gums like her, alloderm doesn't hold up very well over the long term. It tends to relapse years down the road. For her tissue type, we needed to use her own tissue, a connective tissue graft from the roof of her mouth. It's a more predictable, longer-term lasting result. But again, we're not doing that right now. First, let's resolve the inflammation. Then we can plan the grafting procedure properly. All right, so let's talk about the lessons here and the red flags you should watch for as a patient. Red flag number 1, high pressure, expensive treatment plans without conservative options. If a patient or specialist immediately jumps to the most invasive, most expensive option without discussing simpler alternatives, that's a red flag. There should always be a conversation about conservative management first. Red flag number 2, doom and gloom predictions without imaging review. Saying bone loss is inevitable or you'll lose your implant without thoroughly reviewing imaging and showing you exactly what they're seeing, red flag. A good doctor will walk you through the images and explain their concerns clearly. Red flag number 3, rushing you into treatment. If you're being pressured to schedule surgery immediately without time to think or research or get a second opinion, that's a problem. Ethical dentists want informed, confident patients. Red flag number 4, dismissing your concerns or questions. If you feel like you're not being heard or your questions are being brushed off, trust that instinct. You deserve a provider who takes time to educate you. On the flip side, here's what good dental care looks like. Taking time to explain your diagnosis clearly. Showing you the imaging and explaining findings. Discussing multiple treatment options from conservative to aggressive. Encouraging second opinions, no pressure tactics, and transparent about costs and alternative. And here's my advice. If something feels off, get a second opinion. If the second opinion is drastically different, get a third. Your oral health is too important and too expensive to leave to chance. Look, I know I'm calling out another dental office in this video, and some people might think that's harsh, but this is a systemic problem in dentistry that we need to talk about. Dentistry is unique because, unlike most medical fields, it's largely unregulated when it comes to treatment planning. There's often no objective right answer. Different dentists might recommend different treatments for the same problem, and unfortunately, some offices are more focused on production and profit than on patient-centered care. I'm not saying this other periodontist was intentionally scamming this patient. Maybe they generally saw something concerning. Maybe they're more aggressive in their treatment philosophy, but there's a communication issue. I don't know. But what I do know is that when I looked at the same patient with the same scans, I saw something completely different. And that should concern all of us. This is why I make these videos. This is why I'm transparent about cases like this, because patients need to be educated. You need to know what questions to ask. You need to know when to push back. You need to know that you have options. The dental industry comparison to car mechanics isn't just a joke. It's reality for a lot of people. If you don't know what's going on, it's scary and you're vulnerable to overtreatment. So arm yourself with knowledge, ask questions, get second opinions, and find a dentist who treats you like a partner in your care, not just a source of revenue. So here's where we ended up with this patient. Conservative treatment for the implant inflammation. Follow up in 1 month to assess progress. Future planning for connective tissue grafting where actually needed. Thousands of dollars saved. Unnecessary surgery avoided. And peace of mind restored. And I'm confident she's going to do great. If you're dealing with a similar situation, or if you've been recommended dental treatment that seems expensive or aggressive, I want to help. Drop a comment below with your questions. Better yet, if you're in the area, come see us for a consultation. And if you're not in the area, find a dentist who's willing to take the time to explain things clearly and consider conservative options. Remember, good dentistry isn't always about doing more. Sometimes it's about knowing when to do less. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and hit that notification bell so you don't miss future videos where I break down real cases and teach you how to navigate the dental world. Thanks for watching, and I'll see you in the next one.